A tragic case of sepsis in a newborn. What went wrong? When a newborn dies from sepsis, the emotional toll on parents is immeasurable. In this case, a baby born into a seemingly healthy pregnancy faced a life-threatening infection that went unnoticed until it was too late. The story highlights the delicate balance between medical care and the risks of delayed intervention. The baby was initially treated with saline drops via the nose to ease breathing in the hospital. However, after being transferred to a community health service, his condition rapidly worsened. A post-mortem revealed the cause of death was sepsis, a severe infection that can escalate quickly in newborns. The coroner investigated whether Health New Zealand provided adequate postnatal care, focusing on the days following birth. While the coroner acknowledged the baby and his mother received appropriate care, she pointed out critical gaps. Although monitoring was in place, there were missed opportunities to track the baby's vital signs during the 9-hour period between transfer and his sudden decline. This raises a troubling question. Can even minor oversights in observation lead to irreversible consequences? But here's where it gets controversial. The coroner concluded there was no breach of care standards, yet the case underscores a systemic issue. For instance, when the parents pressed for help, the midwife dismissed the symptoms as minor, attributing them to nipple trauma. By the time the baby's condition deteriorated, it was too late. This case also highlights the dangers of sepsis in newborns. Without early antibiotic treatment and intensive care, even minor infections can spiral into life-threatening complications. The coroner emphasized that respiratory distress is often the first sign, but it can quickly progress to severe illness. In this case, the baby's refusal to feed and blood-streaked vomiting were early red flags that were overlooked. The coroner's recommendations aimed to prevent such tragedies. She called for better staffing levels at community health services and clearer protocols for managing high workloads. Health NZ responded by increasing staff and providing educational materials on sepsis. However, the case leaves a lingering question. How can systems ensure that no detail is missed when a baby's life is at stake? And this is the part most people miss. Even with proper care, human error and system limitations can create gaps. The baby's parents deserve a clear apology and support. But the broader lesson is about improving protocols to catch signs of sepsis early. What do you think? Should healthcare systems prioritize more frequent monitoring? Or is it enough to follow established guidelines? Share your thoughts in the comments below.